All right. So to start, can you just give me like your name and where you're working now, kind of that information?
Yep. Yeah, absolutely. So, my name is Dr. Matthew Rivera. I'm working at Indiana State University right now, currently as a doctoral fellow. I completed my DAT degree in 2018, and then I went straight from that into a PhD program at Indiana State, where I'm currently teaching in the both the doctor and athletic training program as well as the some undergraduate courses in applied medicine and rehabilitation.
Perfect. So is there anything you like to do kind of on the side, like any hobbies or anything like that?
I mean, I read a lot, not like heavy research articles. When people say reading, I mean like books. Probably the biggest hobby I have. I like to read some more of the like personal development, kind of leadership type books. So usually have one or two of those going at a time. I spend a lot of time volunteering. So I'm really active in community service here in Terre Haute, specifically with either church service or with helping at risk adolescents. So I work through a organization called Kids Hope that pairs mentors with students in difficult life situations, and so I kind of just get to hang out with some second and third graders every week and just kind of mentor them, help them with homework and stuff like that.
Sure.
Yeah,
That's awesome. Like, truthfully, that's pretty sick.
yeah. I have a really big passion for the next generation because they are going to be the future, and so I know I'm still young as well, but I think the more that we can invest in them, we can stop to see some of these patterns that we're seeing in some adults at this point. So
Right. Oh, yeah, that's awesome. Could you tell me kind of like how your life operates like day to day within the profession?
yeah, so it's different. So I forgot to mention part of my job as well is I'm the managing editor for a peer-reviewed publication in athletic training. So it depends on the day and the part of the semester. So I'll give you last semester, for example, when I was both teaching in the DAT program and the managing editor. So the DAT program is a distance hybrid program, so it's not like there's set times for classes to convene every week. So it's a lot more prep and prep work on Mondays and Tuesdays as I'm opening up the module for students to view and to work through. So that looks like just recording lessons, writing assignments, making sure the assignments match up with the learning objectives, and then kind of just organizing that within. We use Blackboard here, so kind of just organizing that within Blackboard.
Okay.
Um, and then the afternoons usually were spent doing more of the managerial work for the journal that I mentioned for clinical practice and athletic training. And that is just mostly using our online system to track where the manuscripts are at in the peer review process and communicating with authors or reviewers if necessary and just kind of putting together the next issue for the journal. Some other things that kind of are daily are some sort of meetings. So I might have anywhere from one, might have zero, it's rare, but anywhere from a couple to about 7 or 8 meetings a day. Most of those I would say are spent with students, either on coursework or research projects that I'm helping mentor. So those could look like, typically those look like a Zoom meeting because most of our students are at a distance. So it would be them jumping on a Zoom call and we kind of hash out whatever questions they might have, or it might be a check-in. So it could be as quick as a few minutes, just answering a question on a weekly assignment, or it could be up to an hour longer if we're talking about a research project or working through some research manuscripts or something like that. Some other things that kind of go on my daily or weekly schedule would also be faculty meetings or committee meetings. So currently here at Indiana State, I'm a part of the student affairs committee. So I serve as a graduate student representative on the student affairs committee. And so we have meetings bi-weekly for that are an hour long. So that's kind of just going through what's going on with the student affairs and whatever actionable tasks we need to take. Also served on some athletic training committees, so the post-professional committee as well as the just overall athletic training committee here at Indiana State. And those were about once a month. So is that enough details to answer your question?
Yeah, I'd say so. It sounds like you're really busy. I mean, every day.
Yeah. So, I mean, that was kind of going off of last semester where we weren't really actually doing any data collection either. So if we have a research project that we have going on that's doing some physical data collection, depending on so if I'm the primary researcher or if it's a student, but I'm helping collect data, that could also get thrown into the daily or weekly schedule, depending on how many participants we have and how long each data collection takes. So when I was doing a project over the summer, 2 summers ago, that was about 8 hours a day in the lab. That's not always. That wasn't every day, but a lot of the days looked like that because we were doing more mass data collections. Other times it could look like a quick 30-minute data collection period of students coming in between classes to do some sort of measure or something like that. So that's also something that kind of takes up a lot more of the time.
Okay. Kind of just going off of that, do you experience any like difficulties in your own life because of how much time is kind of going on into work?
Yeah. Yeah, no, I think that's something that I struggled with making the transition from working clinically to going into more of an academic role. Because when we think about athletic training, and I worked at the secondary school setting particularly, so it was, when we think about how athletic trainers practice in the secondary school setting, typically it's starting around 2 or 3 in the afternoon when school's getting out. You're there to do the pre-practice prep and prevention, and then you are going to the practices, or you're there for practices or games or events or whatever that might look like for that day. And then as soon as those end, you kind of know that you're done with work for the day, and you might do some documentation or something of that, clean up, prep for the next day or whatever. Then you go home and you don't have patients, like you might have patients emailing you or something communicating, but you're not really working. And so it's kind of a clear line of when you're working and when you're not. But what I noticed is when I first transitioned into this role, the work doesn't ever really stop. So if I'm, grading, or if there's research projects that we're writing on or that we're doing something, those things can all easily be taken home. Not that they should, but that they can. So if I do have some extra time at home and I'm like, okay, I'm going to work on this paper a little bit while I'm here. And so it's a lot easier to take your work home with you. And that was hard for me to learn at first. And what I noticed is that was taking away from those things that I mentioned earlier that bring me joy, specifically reading and service. And so it was taking away time from those things. And I noticed that I just overall just wasn't grateful as I usually am in my daily life. And so it was about the way that I overcame that was setting hard boundaries on time commitments, regardless of if I thought the work was quote unquote done.
Okay.
So what I mean by that is saying I'm only going to work on this for an hour and a half at home, and regardless of how far I get on that, I've got to put it away. And it's still something I'm working on even now, but because the work, it's never done. It's always going to constantly be going. So one of my mentors here has told me this idea of we work to live, we don't live to work. So your work should only be the thing that supplies you the means to live. It shouldn't be the means of your living. So
okay, that's really powerful. Actually, I really like that.
Yeah, I think it's interesting because we do that a lot with athletic training, regardless of the setting or the we have this idea that young athletic trainers or young professionals have to work a ton of hours to get all this experience, and that until they do that, they're not going to be a competent athletic trainer. But I think it what it does is it takes our identity as us as a unique and individual person and wraps it up in the identity that we're an athletic trainer. So if you don't mind, I'm going to ask you a question. But if somebody you don't know on campus asks you like, hey, what do you do? What's your major? The first thing you think of is probably like, I'm an athletic training major, or
Right.
I'm in the athletic training program. I'm an athletic trainer. And so we root our identity in the fact that we are an athletic trainer, not that we are a human who our job is just an athletic trainer.
Yeah, I
So
get, I definitely understand like where you're going with that. And yeah,
yeah,
okay, yeah, I like that. I actually, do you mind if I use that work to live like quote in the?
yeah, absolutely,
All right,
absolutely.
yeah, I really like that quote. Um, so you kind of already mentioned a little bit, but in regards to like your professional career, I know you said you worked at secondary school in the past. Were there any other places that you ever
Yeah.
worked?
So when I was a student in my professional program, I am from California.
Okay.
And so when I graduated from that program, I worked at a high school um, that was a larger high school. So in California, high schools are typically larger. So this high school had about 4,000 students at it, somewhere between 1,100, around 1,100 student athletes. So when I graduated, I got hired there, worked there for the summer, moved out here, worked at a small rural secondary school, and then I also worked at ISU, so in the Division I setting, for a summer as well. I've currently I work as a PRN athletic trainer as well, so I kind of do some clinical work on the side still, and through that I've worked at a couple different smaller colleges here, so Division III or the smaller NAIA kind of schools. I've also had some internships with USA Volleyball, so the Olympic volleyball teams,
Okay.
while I was in my professional education. So I've had a little bit of experience in all of the settings, but the secondary school, high school is kind of where most of my experiences come from.
Okay. Um, I'm sure you get this all the time, but could you kind of tell me like what the craziest like injury that you've had to take care of was or anything like that?
Craziest injury. This one, I mean, the one that is ingrained in my mind isn't one where we typically might think that there's a compound fracture and somebody's bleeding out on the field.
Okay.
But I did have during a JV football game a C-spine injury where the patient was unresponsive and didn't have sensation into his hands and fingers and couldn't squeeze my fingers when I was doing the evaluation. So had to do the C-spine management, equipment removal, spine boarding him with EMS on the field. And so that was probably the one that I always go to. And thankfully, we had just done our EMS training like 2 or 3 weeks before, so they were all fresh on that. So it was, not that any kind of injury in that way is perfect timing, but it was a blessing in disguise because we had just gone through all that.
That'd be really scary. I feel like
Yeah.
definitely.
But
And
that's where you have to rely on your training and your practice that you get in your professional education, and just making sure that you're utilizing all of the resources that you have. So wherever you end up, making sure that you establish a relationship, because I established a relationship with my EMS very early on to make sure that we were on the same page about how we were going to do it, the procedure that we were going to use. We practiced it multiple times, and making sure that you feel comfortable with those skills in your professional education. So when you get time to practice, like making sure you hammer those home.
gotcha. Yeah, I'm sure that's one thing that Dr. Neal's been talking a lot about is just really making those connections and relationships like early because it can really help
Yeah.
you in the long run. So obviously now you're in education. Could you kind of tell me what that switch came from? Like, did you want to try something else, or have you always kind of had like a passion for teaching? Or
Yeah, so in my professional education, I had a job on campus as a student tutor. So those were for like general biochem classes where I was able to get paid to teach other kids how to bio, basically. And that's kind of where this idea of education kind of sparked my interest. And my mentor in my professional program she actually had her EDD, so she has a doctorate in education, and so she kind of sparked the interest as well. And then when I got to ISU, I was a teaching assistant for the post-professional masters and the professional masters and the professional bachelor's degrees for the rehab courses. So continue to get some experience there. My idea was that I would use my DAT degree to work a little bit and then also be a preceptor. So I'm still involved in clinical education, and then move into more of a clinical instructor line as I'm transitioning into academia. But this opportunity to do a PhD kind of just arose at the perfect timing when I was finishing my DAT. And then I had some conversations with my mentors here and realized the value behind having both a clinical doctorate and a philosophical doctorate, so the terminal degree of the PhD, to be the best educator that I can. So the transition was definitely faster than I was expecting. So that was tough to make that decision. I made that decision over a year ago, and so that was it still is kind of tough. But thankfully, I've found other outlets to continue practicing, so I'm not totally removed from it. But it definitely happened a lot quicker than I was expecting.
Sure. So you kind of mentioned that you got like 2 different degrees. Are there any other like certifications or anything that you have? Like, are you CSCS?
So I'm not CSCS. The other certifications that I have involve more interventions. So I have the Graston M1 training, so Graston certified. I think that's the only other one beyond like your basic CPR, basic life support. Yeah, I could go on another rant about why I think some of these other credentials that we as athletic trainers think we need aren't as valuable as we think they are, because we actually learn most of those skills, but people just end up paying for letters at the end of their name, even though your basic professional degree that you're getting to practice as an athletic trainer, you still have all of those skills and knowledge that you need to practice. But we can continue.
Well, actually, I kind of want to go off on that because I am curious. So I have my CPT through NSCA. I got that in my undergrad. And then I heard essentially that I should try and take the CSCS because of what you were mentioning. Like, we already know most of those skills.
So I think it comes down to the idea of like, why do you want it? If you look at most either professional sport or Division I athletic training, depending on the sport positions, they require the CSCS, or the CSCS is preferred. And so that builds this idea in young athletic trainers and young professionals that the ATC credential alone is not enough to practice as an athletic trainer in those settings. And so we devalue the ATC credential by going and getting these other credentials, even though when you go to that setting, you're going to be practicing as an athletic trainer and not a CSCS, because chances are they're going to have a lot of other actual strength and conditioning coaches that are there. And so the reason why is because they're looking for somebody with a different knowledge or a different skill set. So my question is, if you already have those skills and you know that information, find other ways to demonstrate that in cover letters and resumes and CVs versus going and getting that credential, because it's and I mean, we could talk about this from a professional degree standpoint. So does the master's or the post-professional master's, that devalue the ATC degree? I mean, there's this whole conversation about it going on right now, but I think if you look at people's credentials and they have like Graston training and cupping and CSCS and movement therapy and functional movement screening specialists, like all of these credentials, like we learn how to do movement screenings in your professional education. Like if you haven't learned it yet, you will. So why do we need to go out and get a different credential when we know how the body moves and how it should move, right? So it's just this conversation. I would say it comes down to understanding, why do you want it? Do you plan on if you plan on working at a setting where maybe like a smaller Division III school where there might not be somebody with those actual knowledge and skills, and that might actually advance your career? Absolutely, I can see that happening. What I was talking about was this idea of like, we as athletic trainers force other younger athletic trainers to feel like they need to go get all of these credentials when the ATC degree is it, right? Like that's what you need to practice. And so feel confident in that and show your knowledge and skills in other ways versus having to spend money to go take a test that you already have the knowledge for, if that makes sense.
Yeah, no, I understand. So that's actually very like insightful, and I really
Yeah,
appreciate
and I'm sure Dr. Neal can talk about that with you too. Like she'll have more time with you if you have questions. She's. It's kind of this idea that we have at Indiana State that like if you don't actually need the degree because you have the knowledge, uh, value your degree that you have over anything else because that's what's you're gonna spend most of the time on.
it. Okay. So one question about your current profession, I guess, is what do you think is the most challenging aspect of your job?
Whew, I mean, there's a lot of challenging things about my job. I think similar concept to what I was talking about earlier about taking work home. For me, it's um, when is enough enough? So whether that's teaching or whether that's research related or service related, I never know when enough writing is enough writing or when enough prep is enough prep for a class, when enough service is enough service. So in academia, in what we would call tenure track lines, there's these guidelines on what you have to do to earn tenure and earn promotion. But usually they're very flexible and they're very broad. So especially being newer in this kind of position, it's a lot of I don't know when enough is enough. So when you're programming for patients to come in and do rehab, all right, we're going to use these exercises to hit these limitations, and we know these parameters are going to be what we want to use because this is what's been shown to be best at strengthening this. So you have them do that, bang. You know that that's going to be enough for that person that day. But here it is, like I said, the work's never ending. So you never know if what you did that day was going to be enough for the next day to set you up on the next day and the next day. So I think it's understanding and valuing what you've done that day to give you the freedom to kind of go home and relax.
So it's almost like time management to an extent, but like making sure you're giving yourself your own time.
Yeah, I don't know if it's I think it's instead of time management, it's time, it's valuing your time.
Okay.
So like reframing how we think more hours means better work and reframing that to mean more like quality work doesn't always have to be 10-hour days, right? Like we can do high quality work in 7-8 hour work days. So that's kind of so I don't have to take work home and work another 3 hours outside the office.
Okay. Well, kind of wrapping up here, do you have any tips that you kind of give someone like me that's, just kind of looking around the profession to see what really sparks an interest? Because I mean, like, obviously we'll have different clinical locations, but like I'm also interested in like academics, and I don't really know how to get an opportunity to like really experience that side of things per se.
Yeah. So, I mean, I think clinical experiences will give you the introduction and socialization into the different settings. So I would lean towards more of that. I would say during those, making sure you're actually engaged in those, because I know so often we can get into like the mid-semester, end of semester where you're not as excited about the new clinical rotation that you have or the new site that you're working at. And so when there's no patients in there, you guys can kind of just lay out. Like I did the same thing, like where you just lay on the table and you're just kind of hanging out, talking about the weekend, but being engaged and asking questions about what those athletic trainers have to do beyond what they've seen. So talking about like documentation behaviors, talking about like administrative stuff, so that you get a full picture of what that actual clinical setting looks like. But specifically for academia, like there's no clinical rotation for that, right? Like that's not required for professional education. So some things I did when I was in my professional education that kind of gave me that exposure, like I mentioned, was TAing and seeing if I could shadow professors. I mean, that you would have to talk to whoever it is about the idea of FERPA, so you can't see other students' academic information, but talking to them about course prepping and talking to them about their PhD or EDD experiences and what that looked like. Talking to them about research. I don't know if you guys have a research component to your program, but maybe seeing if you could be a research assistant so that you're collecting data for whoever's doing research at Xavier. And just trying to find those experiences that aren't going to be required. So you're going to have to go above and beyond to actually engage with what that setting would be. So asking professors if you could, maybe in your second year, if there's a concept that you really understand during a lab, asking if you can come in and help out with that lab or something like that.
Perfect. Like that actually is super helpful because I've been
Yeah.
like brainstorming
Yeah.
how to like do it, and yeah, obviously like talking to professors, the the best way to at least get some knowledge on it.
Right. And I'm sure they have some other ways that they could, specifically to Xavier, to help try to get you more involved and give you exposure to what that looks like. Like you probably won't be able to be invited into faculty meetings, but just having informal conversations, because that's where a lot of socialization for academia comes into. It's not, like I mentioned, there's not like a clinical rotation that you're going to go to and learn how to be a teacher. It's informal training. It's more of the informal conversations and socialization into the setting. So having those conversations and asking your professors what opportunities they see or they might know of that you could actually gain that experience.
Perfect. That was my last question. Is there anything that you'd want to ask me?
Oh, I'm good.
All right. Well, thank you so much for taking the time out of your day to meet with me. I really do appreciate it, and this was super
Absolutely.
for me. So
Absolutely. If you want to talk more later or you have other questions, feel free to shoot me another email. I jump on Zoom all the time with our students, so I'd be happy to jump on with you.
all right, great. Thank you so much.
Absolutely.
Have a great day.
You too.